When you're searching for a doctor, any doctor, you want a trusted professional with a proven record. Today we're talking with Dr. Christopher Maloney of Maloney Plastic Surgery. He's here to tell us about his practice and a few of the procedures he offers. Welcome, doctor. Thanks for being here. First of all, let's talk a little bit about your background and where you've been, how you got here.
Sure. Well, I grew up here in Tucson, Arizona, which is one of the reasons I came back. And I went to San Diego for college and then Columbia Medical School, where I was for 4 years. Then I went and started in general surgery at Vanderbilt, and after doing 5 years of general surgery and a year of burn surgery at Vanderbilt, I went to Harvard Surgery for my formal plastic surgery. And I finished my training there in 2002, came back here to Tucson, Arizona, and I've been here ever since.
Yeah, not bad. Pretty qualified, huh? Harvard, Vanderbilt. We're talking today about breast augmentation right now, an option that some women choose. Tell us a little bit, what is breast augmentation exactly?
Breast augmentation is for a woman who has small breasts and desires them to be larger, or has lost shape, or their shape of their breast has changed, or it's never really quite developed the way that they want. So breast augmentation is not only a way of making the breast larger, but also helping give it a better shape.
And do some women choose this as a way of reconstructive after breast cancer, things like that?
Absolutely. There's basically the cosmetic form of breast augmentation, where a woman is actually otherwise healthy and they're using it just for cosmetic purposes, either for enhancement or to improve the shape. And the other reason is after breast cancer for reconstruction, we'll commonly use an expander and followed by an implant for a reconstructive option.
You hear about that quite often. And we were playing with your props before the show. Let's talk about the difference between these saline and silicone. What is the difference?
Sure. First of all, I'll start with the silicone implants. Many years ago, there was a bad reputation with the silicone implants. They were manufactured with a silicone oil, and if they ruptured or leaked, that silicone material could migrate throughout the breast. They've actually changed the way that they make them now, and these are the new sort of gummy drop types of implants, and it's basically made now out of a cohesive gel. If you actually look at the implant and you pick it up and you feel it, it's got a silicone shell, the same as a saline implant.
This is silicone?
Correct. This is a silicone implant. And it's got a silicone shell, and then it's filled with a cohesive silicone gel. So if you actually cut this in half, the material sticks together and it won't leak and it won't migrate throughout your body. So one of the advantages of a silicone implant is, again, when you put this in the body, after the body's healed, it will basically stay there and should not cause any problems, and has a very low chance of complication rates related to the implant itself.
Okay, and then tell us about the other one there.
The saline implant is actually one of the more common ones probably in the last 10 years for breast augmentation, because the silicone ones weren't as widely available. Now things are changing where the silicone implants are probably a more popular option for breast augmentation. The disadvantage of the silicone implant is you have to make a slightly larger incision, and you also have a larger cost component because of the fewer numbers of companies that are available to produce them in the United States, and because of data requirements by the FDA and so on and so forth. So they're a little bit more expensive than the saline implants.
And what's the recovery time? You mentioned a little bit larger incision, things like that. Is the recovery time different between the two?
The recovery time is the exact same for both implants. There's no difference in recovery time.
And what is the recovery time?
The recovery time is anywhere from 24 to 48 hours to 2 weeks, and what it really depends upon is what you mean by recovery. The operation's an outpatient operation. It takes less than an hour and you go home the same day. We put a waterproof dressing on, and we don't even use constrictive bandages or dressings like we used to. So now we typically ask a woman to go home, take a nap, and then when they wake up, take a shower and shampoo their hair, because it forces them to use their arms and their hands. After that, other than some soreness for about 24 or 48 hours, people are very quickly getting back to their usual activities. And usually they basically describe it as feeling like they worked out way too hard, but it's a tolerable amount of discomfort.
Who do you think would be a good candidate? We mentioned the reconstructive, the cosmetic. Who would be the perfect candidate, if there is one?
From a cosmetic standpoint, the two most common patient populations that I see, one is a younger woman who's got a smaller breast size or a shape that is not appealing to them, who wants to enhance their breast shape or their size. So that's the number one. The number two is typically what we call the mommy makeover, a woman who has had, a few kids and is done breastfeeding, is done having her children, but has basically lost a lot of the volume and shape due to being pregnant and breastfeeding. So those are the two main patient populations.
What do you think it is that a woman has to consider before she goes through this? Because this can be a significant change to a woman's body. So what would you encourage them to consider?
There's a couple things. One is you really want to understand the two different types of implants to make an informed decision of which implant's going to be best for you as an individual. The second thing that they really need to understand is that these are implantable devices, and although we'd like them to last forever, a woman has to understand that they may not last forever and they may need future surgery.
All right. Well, doctor, thank you. Informative stuff.
Thank you very much.
And if you are thinking about enhancing your look, just call Maloney Plastic Surgery 298-2330 or go online maloneyplasticsurgery.com. And if you mention you saw them right here on The Morning Blend, you can get your consult fee waived. Again, just mention you saw them on The Morning Blend, and when you call 298-2330 or go online maloneyplasticsurgery.com, and don't go anywhere. The Morning Blend will be back in just a couple of minutes.